Good afternoon and welcome back to Downing Street for today's coronavirus briefing. And I'm joined by the Deputy Chief Medical Officer, Professor Jonathan Van Tam, and by NHS England's Medical Director for Primary Care, Dr. Nhs Vaccination. And before I update you on the coronavirus response, I'd just like to take you through the latest data. If I could have the slide, please. There are still 29,326 patients with COVID in hospitals across the UK. And as you can see from this slide, that is still more than either the April or at the November peaks. And sadly, 841 deaths have been reported on average each day over the past week. My thoughts are with everyone who's lost a loved one to this deadly disease. Today I'd like to update you on three important parts of the coronavirus response. The first is our next steps on the vaccination program. It's now 2 months to the day since Margaret Keenan got her first jab, the first person in the world to be vaccinated with a clinically authorized vaccine for coronavirus. We have now, as of today, vaccinated more than 12.2 million people. That's almost 1 in 4 of all adults across the United Kingdom. Take-up of the vaccine so far has been significantly better than we hoped for. Based on the work we'd done before the vaccination programme started, and looking at the surveys, we knew that the UK had one of the most positive attitudes to vaccine uptake. But even so, we thought we'd get take-up of around 75%. I'm really pleased to be able to tell you that as of midnight last night, among the over 80s, we've now given a first dose to 91%. Among those aged between 75 and 79, it's 95%. And almost 3/4 of those aged between 70 and 74, who were the most recent group to be invited. We've also visited every eligible care home with older residents and offered vaccinations to all their residents and staff. So among eligible care home residents, the take-up is 93%. But we'll not rest until we vaccinate all those in the most at-risk groups. Because vaccines save lives. They protect you, and there's increasing evidence that they protect all those around you as well. The fewer people who are left unvaccinated, the safer we'll all be. And the more securely we'll be able to release restrictions when the time is right. I've been thrilled to see so much enthusiasm about coming forward for a jab, and I'm just so pleased that take-up has been so high. But we're not going to rest until all those who are vulnerable have been protected. So the NHS and local authorities and the teams working with them are doing everything they can to reach the remaining people in these at-risk groups. And we'll keep on searching for those final few percent, even as we expand the offer of a vaccine to younger age groups. And I'm going to ask Dr. Vaccination to say a few words more about this project in a moment. We're on track to meet our goal of offering a vaccine to everyone in priority groups 1 to 4 by the 15th of February, which is 1 week today, before moving on to the other JCVI priority groups. The NHS has worked hard to contact everyone in groups 1 to 4, but we want to be certain. So from today, I have a message for everyone aged 70 and above. Until now, we've said, please wait for the NHS to contact you. But now that message is changing. If you live in England and are 70 and over and have not yet got an appointment to be vaccinated, then please contact the NHS. The easiest way to do this is through the National Booking Service online at nhs.uk. Or if you can't get online, then you can call 119 or you can speak to your local GP practice. If you're in Scotland, Wales or Northern Ireland, we are also on track, working together to meet the goal by the 15th of February and your local health team will be in touch. I'm so grateful to the whole team who are delivering this vaccination program so brilliantly across the whole United Kingdom, and to everyone who's doing their bit by bearing their arms and getting the jab. While we use our vaccination program to go on the offensive against this virus, it's very important that we keep our defences up as well. Our testing program has also grown at a blistering rate. We're now carrying out, on average, 4.5 million tests every single week. NHS Test and Trace is returning 97% of in-person tests by the next day. Contact tracing is performing incredibly well, reaching over 97% of contacts where details are given, and 98% of those they're reaching within 24 hours. I want to say a massive thank you to the NHS Test and Trace team who've built this extraordinary capability, almost from scratch. Even in lockdown, testing to find out where the virus is critical to break the chains of transmission, to find those positive cases, so people can isolate and stop the spread. Today, I'm delighted to be able to announce another step forward to bolster our onshore test manufacturing capability. We're joining forces with the Derby-based manufacturer SureScreen to deliver 20 million rapid tests which can produce results in 30 minutes. They'll be used in our asymptomatic testing program to identify the around 1 in 3 people who get the virus but have no symptoms at all, yet can still pass it on. This expanded capacity means we can offer more regular testing to even more people. Many employers are already taking up the offer of rapid, regular workplace testing, which has protected critical workers like in the NHS and in schools so that they can keep going. Employers who've introduced workplace testing tell me that they find it useful for early identification of people who have COVID, and so the number of outbreaks reduces as time goes on, and so lowers the number of people who are off work with COVID. This is a really important part of what we need to do. From today, we're expanding the offer of regular workplace testing to all businesses with over 50 employees in sectors that are currently open. Testing will become even more important as we exit lockdown when the time is right. Of course, for now, you must work from home if you can, but if you can't, we want to make sure that we're providing as much certainty and confidence as possible. And I'd urge all eligible employers to take up this offer. You can go online to the portal at gov.uk/coronavirus, and this will all help to keep vital services going and to keep the virus on the back foot. The third thing I want to touch on is our work to tackle new variants. All viruses mutate over time, and part of controlling any virus is responding to new variants as they arise. We do this every year with flu, for instance, and knowing this, we invested in the genomic sequencing capability right at the start of this pandemic, because genomic sequencing is how you identify new variants. And we've given the UK one of the biggest genomic sequencing capabilities in the world. In fact, the UK has provided almost half of all of the COVID sequences that have been provided worldwide. This genomic capacity has allowed us to spot variants here at home and is allowing us to support others to detect variants in other parts of the world. We mustn't let a new variant undo all of the good work that the vaccine rollout is doing to protect people. Now, the first line of defence is to spot and suppress new variants aggressively wherever they're found. Hence the tougher measures at the border and the firm action we're taking in those small numbers of areas where variants of concern have been found in the community, including door-to-door communications and enhanced testing and sequencing. At the same time, since the emergence of variants of concern late last year, we've been working on how vaccines can be used to tackle them. It is imperative that our vaccination program keeps pace with any changes to this virus. Professor Van Tam will be saying a little bit more about what we're doing. The work has 3 parts. First, the evidence is that the existing vaccines have some effect against new variants, particularly preventing serious illness and mortality. So the existing vaccine rollout is mission critical for tackling new variants too. Second, we're working with the existing vaccine suppliers on potential booster jabs, targeted specifically at the new variants to strengthen this protection further. Third, we're building onshore UK capacity, including cutting-edge mRNA technologies, to give us the ability rapidly to develop and deploy vaccines against any new variants or similar new diseases in the future. We've entered into a new partnership with the vaccine manufacturer CureVac to develop vaccines that can be quickly adapted as new strains are identified, just as we do the flu vaccine each year. I am determined that we build this capacity right here securely in the UK to protect everyone across these islands, not just from new variants now, but in the long term too. We've agreed an initial supply of 50 million doses to add to the 400 million doses that are already in our vaccine portfolio, so we'll be prepared for whatever the future might bring. Of course, the fewer new cases of coronavirus that we have, the lower the chance of a new variant appearing domestically. So the essential message to stay at home and follow the social distancing rules is our best defence right now. Taking all of this together, what I want to say is this. The number of people in hospital is still far too high, but it is falling. The number of people who are dying from this disease is also far too high, but that is falling too. We're turning a corner in our battle against coronavirus. The vaccine rollout is going well, and if you're aged 70 and over and haven't been contacted yet, please get in touch now. And all the time, we must be vigilant and do what it takes to tackle any new variants that arise. For now, the most important thing that you can do is get the jab when your time comes, stay at home, protect the NHS, and save lives. I'm now going to turn to Dr. Kanani to set out the details on increasing that critical uptake and making sure that we reach everybody who is vulnerable to coronavirus, and what we are doing to hit the target of making sure we get an offer to everybody in priority cohorts 1 to 4 by the 15th of February.
Thank you very much. So could I start today by paying tribute to my NHS colleagues who have been working tirelessly behind the scenes, whether you are planning the vaccination programme behind a screen or in an office, you're a car park steward shoveling snow and moving cars around, or you're a member of the practice management team who is setting up these clinics, you are part of a historic moment. I know that the adverse weather conditions have been really tricky, but I also know that that has not stopped us. We have set up over 1,500 vaccination sites now around the country, and that is from mosques to museums, from gurudwaras to games grounds, from cathedrals to community centres. Every eligible care home has now had a visit, but if you're in a care home and you weren't able to have your vaccination, either because as a resident you'd been unwell, or as a member of staff you weren't quite ready to say yes, we will come back to visit you because we want to make sure that everyone can take up this offer. This weekend we were vaccinating almost 28,000 people every hour that we were operating. That means that we were doing everything we can to protect you from this virus. And the snow has not stopped us. We've had teams in Skipton, in Yorkshire, GP surgeries who've created 8 teams, and over the weekend visited over 300 people in their own houses. So wherever you are, however you need the vaccine, if you're in the priority cohort, you will be offered it. This week, we'll be sending out letters and we'll be making phone calls to make sure that if you're in that priority cohort, you will have that offer. And if previously you've had the offer and you weren't sure and you've changed your mind now, please take up the offer when you're contacted, because that decision could save your life. And as Secretary of State said, until now we've asked you to wait because we wanted to contact you for your vaccination. But if you're over 70, let me be clear. If you've had an offer and you've not taken it up yet, please come forward now. The best way to do this is through the online booking service, through nhs.uk. But if that doesn't work for you, you can also telephone 119. And I also know that our teams, made up of GPs, nurses, pharmacists and more, around the country are waiting to vaccinate you if you still need your vaccination this week. Can I just remind people that if you're in the priority groups and you've had an appointment come through from your GP and the national booking system, choose one and keep that, because it means that we can make another appointment for somebody else. So finally, the NHS vaccination programme is the most incredible programme that we've rolled out in history, but we all have a role to play to make sure that no one gets left behind. So if we've not been in contact with you and you're in the priority groups, please get in touch with us.
Thank you very much, Dr. Kanani. And now I'd ask Professor Van Tam to set out more details of what we're doing on the vaccine front, in particular with the new variants.
Thanks, Secretary of State. Before I say a few words about variants and vaccines, I'd just like to add my thanks to the NHS staff and the volunteers as well who are working the vaccine centres. And whenever I can get out and put a shift in alongside you, it's an enormous privilege to be able to do so. So thank you. Now turning to the variants and vaccines, I'll say a few words particularly about the South African variant, which in the trade we know as B1.351, and because this has been in the news quite a lot in the last few days. So that South African variant 351 is now dominant in South Africa and causing the vast majority of the cases that they encounter. It has been detected in the UK, but in very small numbers, and it is not our dominant virus. Our dominant virus at the moment is a variant which was first identified in Kent, which you'll be aware of, and we call that one B1.117. And you will know from what we saw before Christmas with the 117 variant that if it has a distinct transmissibility advantage over the predecessor, then it can establish itself very quickly indeed. But early data on modelling of B1.351 does not suggest this is so, does not suggest that the South African variant has a distinct transmissibility advantage over our current virus. And because of that, there is no reason to think the South African variant will catch up or overtake our current virus in the next few months. And that's a really important point. That being the case, our immediate threat is from our current virus. And there is now plenty of evidence that the vaccines that we are deploying are effective against our current virus. So from that perspective, look, please don't delay if you're called. Take the advantage to protect yourself against the clear and present danger, against the immediate threat. Turning now a bit further afield to the South African variant and the future, several vaccine manufacturers, including Pfizer, the manufacturer of the vaccine that's deployed here, Novavax and Janssen, with whom the British government has arrangements, they've already released either some preliminary clinical or serological data about their vaccines and the South African variant. And taken as a package, they do give me confidence that there is still likely to be a substantial effect of the current vaccines in terms of reducing serious illness, even if infections are not as well prevented. Now, AstraZeneca, of course, the UK Oxford University vaccine, is the one that has been in the news most recently, But my feelings about the AstraZeneca vaccine are essentially similar. The South African trial was in young adults and reported mild disease and a reduced level of protection against infection. But that really doesn't change my view that it is still rather likely to have an effect on severe disease. And to people who are kind of on the edge going, well, shall I have this current vaccine or shall I kind of hang on for, a South African variant vaccine when it arrives? My advice to you is very simple. Do not delay. Have the vaccine that will protect you against the current threat. And don't worry, you can be revaccinated. For people who've had a full course of 2 vaccines, a revaccination is probably only going to require 1 dose. That requires some science work to confirm it, but that is my hunch. And you can be revaccinated, and we're taking a lot of steps behind the scenes to ensure that we can be in that position. So should we be engaged in thinking and planning behind the scenes for needing variant vaccines at some point in the future? Absolutely yes. Just as variations to the virus were inevitable, it's almost inevitable that we would at some point need variations to the vaccine. So this is not a big fright, it's not a big surprise, it's something that we have anticipated for quite some time. Is it therefore reasonable to begin to frame our longer term thinking about possibly needing an annual or a biennial booster in high risk groups? Yes, absolutely it is. That's the right way to frame it. There's no decision's been made, not enough science information under the bridge yet, but it is definitely the right way to frame it. So if you read the headlines and you feel a bit panicky, or you think there's some kind of immediate problem, please try and be reassured. The better watchwords are concern, of course we're concerned, vigilance, yes, we're hyper-vigilant, and preparation, there is a lot going on behind the scenes that will become clearer over the course of time. Thank you, Secretary of State.
Thank you very much, Professor. Now, we'll now go to questions from the public, and then we'll turn to questions from the media. The first question from the public is from Samantha from Lancashire by video. Samantha.
When are frontline police officers likely to receive the vaccine? Like paramedics, they have to go into many different houses a day, and there is a high risk of either taking the virus home or passing to one of the many elderly or vulnerable people they come into contact with on a daily basis.
Thank you very much, Samantha. A very important question, and I want to thank police colleagues who are doing so much to protect us at this time, including making sure that the rules that we have on social distancing are enforced. And I'm particularly grateful to the police for the work that they're doing on expanding that enforcement. Directly answering your question, we have ensured through the clinical advice that we've taken that the vaccine rollout goes through those who are most at risk first. So any police officer who is aged over 50 will be part of the initial rollout through the current groups down to through what are called the JCVI cohorts 1 to 9 from the Joint Committee on Vaccinations and Immunisations, which advises us on the clinical basis for the order. After that, we will then look at what order we go next, and we'll consider, for instance, questions of people who are in professions where you might have to be in contact with more people, and the impact of the vaccine on transmission, and make a decision and publicise it as soon as we've made that decision. No decision has yet been made for where we'll go, in what order we'll go after the JCVI cohorts 1 to 9, but we're looking very closely, including at where the police officers should be in that order. The next question is from Wendy from London by text. Wendy asks, will it be possible for adults to adjust the second dose of vaccine to work? Will it be possible to adjust the second dose of vaccine to work more effectively against the new variants, or could a booster be required next autumn? JVT, definitely one for you.
Yes, so thank you. I think I've kind of framed the answer to your question in terms of really it's more likely to be the booster required next autumn. With the new technologies such as the messenger RNA vaccines and the adenovirus vector vaccines, that covers Pfizer and Oxford AstraZeneca respectively, you can move pretty fast to vary the virus in the vaccine. And we're talking about a matter of weeks rather than a matter of many months. Nevertheless, those vaccines still have to be tested in a small-scale way to make sure that the immune response is the same as with the previous version, and then they have to be produced. So I think the notion in your question, Wendy, of adjusting the second dose to work more effectively is probably not one that's realistic, but an autumn booster, if required, is very much on our radar. But just to repeat the point again, your question kind of implies that the vaccines we've got aren't going to work against the virus we have. That is not true. The virus we have is the virus first identified in Kent, B1.117, and the vaccines we have are almost certain to work against that virus.
Thanks very much, Professor Van Tam. Next question is from Fergus Walsh at the BBC. Fergus.
Thanks very much. Question for Professor Van Tam. Do you think it will be possible to keep the South African variant largely suppressed in the UK? And also, what would your message be to people who may just see fairly scary headlines about about virus variants and their potential effect on the efficacy of vaccines?
So, thank you, Fergus. We have small numbers of the South African variant in the UK at the present time. And as I've said, I'm not seeing, and the early modelling data do not suggest, a transmissibility advantage for this virus. So that being the case, it's not going to kind of overrun or overtake the current B1.117 virus in the next few months, or that is the most likely scenario, that it won't happen. Now, so from that perspective, I don't think that this is something that we should be concerned about right at this point in time, and I agree with you that the stories and the headlines around variant viruses and vaccines are a bit scary, and I wish they weren't. We are watching this, and I said before that the watchword is vigilance, and behind the scenes for many weeks now, the focus of my work has been on thinking over the horizon and thinking about what preparations do we need to put in place to give us a long-term, resilient, vaccine-orientated solution to this problem. And that includes the potential for variant vaccines for the autumn.
Thanks very much, Fergus. The clear message from both the clinical community and the NHS and from us as ministers is that when you're offered the jab, please get the jab. And if you're 70 or over, then now please come forward to get the jab if you haven't got your appointment booked yet. Thanks very much. The next question is from Libby Vina at ITV.
It's a question for the Secretary of State, Mr. Hancock. If we can't stop transmission through vaccination, what is the plan? Are we going to have to live with a large number of cases of coronavirus for years to come? Or are we going to go for an elimination strategy, as, for example, has happened in New Zealand? And a question for Professor Van Tam, if I may. Is surge testing underway for both the South African variant and the mutated version of the United Kingdom variant? And how many cases have actually been picked up? What is the latest data on those variants?
Thanks very much. Well, Libby, the answer is really clear. that we have a high degree of confidence that the vaccine will work to make people safe, and it is vitally important that people come forward for their vaccine. We have a plan for what to do if we need to update the vaccines to work on the new variants. But we also have a plan to keep those new variants under control and keep them suppressed. And currently, the number of new variants that have been identified is 147. So, as you can see, that's a relatively small number compared to the about 20,000 a day of the old variant that we're getting. And 147 is in total over the past 2 months since these first started to appear. And in fact, there have been no new cases in the last 2 days. So we are currently working very hard to suppress those using the enhanced testing and isolation, at the same time as making sure that in the future we will have the vaccines available to tackle any new variant that comes along. All that means that we can protect people, and we are going to be able to take steps as the number of cases comes down, as the numbers in hospital come down. But it's too soon to say anything more on the timings of those right now. Professor Van Tam.
Secretary, I'm not sure I can really add to your answer, other than to say that the UK has really probably the largest amount of sequencing capacity anywhere in the world, and that although with the number of cases we have right now, it is not possible to sequence every single case of coronavirus identified through testing, there will come a point when these figures start to fall dramatically where we will be able to sequence pretty much everything that we pick up.
But sorry, could I just come back on that? Are we aiming for eliminating coronavirus, or are we going to have to live with cases in the community for years to come?
Well, of course, everybody would like this disease to be completely eliminated from this earth, but we have to make sure that we are vigilant against it, and both coming in from abroad with the work that we're doing at the borders, where we've strengthened measures, and also the action that we're taking here, where the vaccine adds a huge weapon in our arsenals as a society for how we can deal with this. We, as Professor Van Tam was setting out, there is work underway on whether a booster is needed, and on that I'd point you to how we deal with flu each year. Flu is dealt with through an annual jab, and the jab is updated each year according to the mutations and variations that have happened and been spotted in the preceding few months, and then is manufactured over the summer and then delivered into the arms of those who are most vulnerable to flu in the autumn. And so we need to be thinking about how to protect people in a similar way. Should we have a similar approach in the future? But for now, it's really important that the message is absolutely crystal clear to everybody watching this tonight, which is that when the call comes, get a jab. The good news is that if you're 70 or over and you haven't yet got that appointment booked, then come to us and come to the NHS, and we'll get that appointment booked in ahead of deadline on the 15th. And then we're doing the longer term work that's needed to make sure that everybody's protected. I hope that answers the question. Professor.
Yeah. Libby, I think I've kind of got where you're aiming at last here. So the key thing is to think about, to frame this in terms of how we manage seasonal flu. And we manage it every winter, and we manage it through vaccination, and we manage it through making sure that the disease burden doesn't overwhelm our hospitals. The key with this coronavirus is, again, through vaccination, to take the whole curve and shift it to the left so that the vast majority of the illness is an illness that is manageable in the community. as opposed to causing enormous pressure on our hospitals. And we can do that through vaccination. And if we do that, we open up a whole way of living normally, or much more normally, again in the future. So that for me is really the key, shifting the whole curve to the left, if you like, away from the hospitals and into a manageable community illness through vaccination.
Thanks very much indeed. Victoria MacDonald from Channel 4.
Thank you, Secretary of State. You've just described the testing programme as growing at a blistering rate, and you've praised contact tracing, and yet there are numerous reports of contact tracers at call centres being made redundant. And in fact, we've spoken to one who said that they'd been reassured that they would have work until May, only to be told that their jobs will go next week. So why is this happening right now, and is this wise right at the moment?
Well, as I say, the performance of the NHS test and trace has been absolutely fantastic. And we know that it took time to build up, and we always said that it would take time. But now with those figures of the turnaround times, 98% of contacts reached within 24 hours, and 97% in total of contacts reached where we have those contact details. So it is performing extremely well. Of course, we're constantly working to ensure that it delivers that very, very high quality performance. And in fact, we're putting more resources into the areas where we have significant concern, where there's a variant of concern. So it is performing absolutely brilliantly, and I'm very, very proud of all the people who are doing that. And the good news is that also, because the number of cases is coming down, so the number of people who are positive, and therefore the number of contacts, is also coming down too. Thanks very much. The next question is from Kate Ferguson at The Sun.
Hi, this is a question for you, Mr. Hancock, and Professor John Van Tam. There's been calls for the return of the rule of 6 outside from next month. I wondered, can you give Brits any hope that this could happen? And is outdoor group exercise and socialising one of the safer restrictions to ease first?
Kate, it's very tempting to get into this, but we're not going to get into this at all. It is too early to say, and it is too early to speculate on any of the measures that we might be able to take. The Prime Minister has set out that he will publish a roadmap on the 22nd of February, take into account all that we know by then, and I think we'll have to leave it there. We're not getting into any speculation about what might happen next. Thanks very much. Jess Elgott from The Guardian.
Hi there. Secretary of State, the Prime Minister said today that strict border controls are actually more effective once a country has a very low internal infection rate. So therefore, should people be prepared for there to be very tough, perhaps even tougher restrictions on travel until there is widespread international vaccination? And are we talking about months or maybe even years of that? And another to Professor Van Tam, if I may. Brits have been cautioned by ministers and by scientists that it's too early to book any summer holiday abroad this year. Would you say that it's also too early for people to book summer holidays, particularly those with other households within the UK? I know we've talked about a great British summer, but now we know that a third booster jab might be needed in the autumn.
Well, thanks very much, Jess. The fact that we only have seen 147 cases that we know of new variants here, other than the Kent variant, on which we know we have a high degree of confidence that the current vaccines work, means that we need to protect the country from new variants, but also that those numbers are really very low. Hence the toughening that we took last month to measures at the border, and we're on track to deliver on the stronger border measures still from countries particularly of concern by next Monday. The reason it's important to get this set up now is that the proportion of cases coming from abroad at the moment is obviously very low, not least because it is currently illegal to go on holiday anyway. And of course we want to lift these measures, as with all the other measures, as soon as is safely possible. But until we know, we need to know more about the impact of the vaccines on all these different variants, and therefore, for now, the precautionary principle is the right approach. I don't know whether Dr. Kanani or Professor Van Tam?
Thanks for the question, and I can't answer it. I think it's just too early to say. We don't yet have the readouts on the success of the vaccine programme, though I expect we to start to see those within 1 to 2 weeks. Public health countermeasures, non-pharmaceutical interventions, social distancing restrictions, they will have to be released gradually. How quickly they can be released will depend upon 3 things: the virus, the vaccine, and the extent to which the public obey the rules that are in place, which thankfully the vast majority always do. And then really, the more elaborate your plans are for summer holidays, in terms of crossing borders, in terms of household mixing, given where we are now, I think you just have to say you're stepping into making guesses about the unknown at this point. And so I can't give people a proper answer at this point because we don't yet have the data. It's just too early.
Thanks very much, Jess. And final question is from Alex Rogers of My London and Yorkshire Live. Alex.
Good evening, Matt Hancock. You've announced a significant increase in testing to reach businesses today. Will small businesses, in particular early years and childcare providers who have been fully open throughout the lockdown, get any help to test their staff? Will employers be expected to pay for tests for their staff, and how much will it cost them? And my second question is 147 cases of the South African variant have been identified in the UK, including 3 areas of London, as previously reported. Has surge testing successfully contained the variant from spreading beyond those 3 areas? And if not, where else in the capital has it been found?
Thanks very much. On the second part of your question, thus far we have not found any further extension. And when we do, including whether that's through the extra testing that we've put in or through the core testing system, we will absolutely publish that. And it is it's very important that we publish that as quickly as possible so that people in that local area know that there's a challenge. On the first part of your question, it's completely slipped my mind. You're going to have to ask it again. I apologise.
Okay, sorry. I was saying, beg your pardon. You announced a significant increase in testing to reach businesses.
Oh, yes.
Will small businesses, in particular early years and childcare providers who've been fully open through the lockdown, will they get any help to test their staff?
Yes.
Will employees be expected to pay for it, and how much will it cost them?
Yes. So this testing is free for now, and we're always looking to who we can expand this testing to. So I want, in the same way that we've expanded it to the NHS, to schools, to hundreds of large employers, we now want to expand it to employers of more than 50, and obviously look at how much further we can go after that. And the point that you make about those providing childcare is an important one, and is part of our plans, and we'll set out details in due course. I don't know whether Dr. Kanani, you want to say something about this expansion across the NHS, because the regular testing has been used in the NHS as probably one of the first places that it went to.
Yes.
And we've seen the effectiveness.
Yes, absolutely. So we've been using what's called the lateral flow testing and asymptomatic testing across the NHS for some time now, expanding into primary care. So that is into general practice, pharmacy, dentistry, optometry. And so people have been getting used to testing twice a week to make sure that they can keep well, and obviously having a subsequent test if they need it, and have adopted that really well. So it's something to be recommended.
Thanks very much indeed. That ends the coronavirus daily briefing for today. Thank you.